Okie dokie, so the first page, what I've done is just put a bullet point CV of me. So these are the things that I do in the UK, yeah. These are things that I've done over 20 years, yeah. So let's have a little read. So is everybody okay with everything on that list? Does anybody want to know any more about anything on that list? Because there's got to be things that we do in the UK that's different to what we do here. Is there anything on there that you want me to expand on at all? Okay. Okay, right, so predominantly this course is on first aid, so I'm just going to start off with what first aid is and what we can do, all the different scenarios. So I've missed a few things out from the UK that's not relevant here, but hopefully we can have some open discussion as well. There is missing words and missing phrases, all right, so it's to stop you drifting off and it's to keep you engaged, yeah, all right. Okay, so introduction to first aid. So first aid is the critical first action carried out when a patient suffers an incident. It is essential that any first aid is carried out not only rapidly, but also with some consideration to what the outcome is likely to be. So our first important action is don't panic, right? And especially if it's a dog that we're heavily involved with, like one of our own dogs, we're more likely to panic, yeah? So you've got to try and keep under your panic threshold, yeah, all right. So you become adrenalized and then you go into panic. So you've got to keep under your panic threshold. So there's a saying in the UK with dogs that if they go into panic, it's called something. Does anybody know what that's called? Begins with F. If they're frightened, fight or flight. Has anybody heard of fight or flight? Yeah, all right. Okay, so the sympathetic nervous system sends out impulses to glands and smooth muscles and tells the adrenal medulla to release adrenaline and noradrenaline into the bloodstream. So these are the stress hormones. They cause several changes in the body, including an increase in heart rate and blood pressure. Now in the UK, we have a law that allows you to do first aid to animals, all right? Does anybody, especially the vets, do you know what the law is in the UK that allows you to do first aid to animals in the UK? Any ideas? No? Anybody else know? Can you remember?
Under the supervision of
Nearly. The Veterinary Surgeons Act. So in the UK we have the Veterinary Surgeons Act 1966, all right? So you can write that down, that's what your gap's there for, all right?
1966?
Yeah, 1966, yeah. So in the UK, under the Veterinary Surgeons Act 1966, anyone may perform first aid to animals, but you have to have 1, 2 or 3 of these as your final outcome. But in any first aid situation, you have to what's the first aim? You're preserving life, yeah, yeah. First one, to preserve life. Second one, to prevent, yeah, suffering, yeah. And the last one, to prevent the deterioration, yeah, or worsening, yeah. We're going to concentrate on dogs really on this course. You have to know the normal parameters for a dog, all right? So normal temperature, etc. So normal temperature for a dog. Does anybody know what the normal temperature is for a dog?
normal temperature for dog.
Yeah, between 101 and 102. Yeah, it's fine. Yeah.
So 102? Yeah,
101.2 to about 102 is normal. Yeah. Does anybody need it in centigrade? Yeah. 38.2 to 38.7. Yeah. If anything's abnormal, we then need to think what's wrong with the dog. All right. So first one. So a high temperature is called hyperthermia. Yeah, good. High temperature caused by infection.
Pyrexia.
Yeah, pyrexia. Pyrexia. Yeah.
You're all reading this, so you still don't know what it is. Shiva Kumar.
Okay, and a low temperature caused by hypovolemic shock. Yeah, hypothermia. Yeah. So anything with hypo in it is anything low. Yeah. Like in distemper, you get a fluctuating temperature. Diphasic, yeah, diphasic temperature. So those are the common temperature abnormalities, all right?
Diphasic is two
yeah,
goes up, goes down, goes
yeah,
up,
like in distemper, yeah. Right. So normal pulse rates. Any idea what normal pulse rate is for a small dog?
160.
Yes, yeah, that would be quite high. So 130, 140 would be fine. Yeah. Medium dog pulse rate. So bigger dogs, the heart goes slower. Yeah.
120.
Lower than that. So 80 or 90. Yeah. And a big dog, you don't get many of them here, but in the UK and in Europe we have big dogs like St Bernards and things like that. Great Danes below, yeah. So 55, 60 beats a minute for a big dog. Pulses you can feel in 15 seconds. Times it by 4, then you'll get an accurate heart rate. And the easiest place to get the pulse rate is the femoral artery, yeah, which is in the back leg, yeah. So pulse abnormalities can be raised rate, lowered rate, weak pulse and irregular pulse, yeah. Okay, respiration. So respiration is the normal exchange of oxygen and carbon dioxide between the air and the body tissues. So normal respiration for a dog is what to what? So a big dog would be about 10, if it was a giant dog, and then small dogs about 30. Alright. So the mucous membrane colours, obviously this is in black and white so we can't see it, alright? But the first picture, the gums are really, really white. Does anybody know what the normal capillary refill time for a dog is? So when you press, yeah, 1 to 2 seconds, yeah. So that's when you press the gum till it goes white, take your finger off, it should go back to pink in 1 to 2 seconds, yeah. The picture on this, the tongue is blue. So what's it called when you've got blue?
Cyanosis.
Cyanosis, yeah, good. The last one, the gums are bright yellow. You can't see it obviously, but the gums are bright yellow. Jaundice, yeah. So what organ does that implicate? Liver, yeah. 2 causes?
Kidney.
Not kidneys, liver, yeah. So what would cause that? Leptospirosis, yeah, was the main one, yeah. So you need to put it in some kind of sensible order. So very similar to human first aid at this stage, your A, B's and C's. So what does A, B and C stand for?
Airway, breathing,
Yes, airway, breathing, circulation, yeah. All right. So same as human first aid. So with this in mind, the first thing we check, is the dog breathing? Yeah. So care must be taken to remove the blockage. Let's say a dog's been hit by a car, it's unconscious. There's a few things that could be blocking the airways to make the breathing laboured. Any ideas? What was the main thing that could be blocking the airways with an unconscious dog? Tongue, yeah, tongue. Yeah, so it's not that they swallow the tongue, but the tongue will roll back and block the airways. Yeah, all right. Then blood, because when blood coagulates, you get blood clots. Yeah, so you need to get your hands in and scrape it all out. Yeah. Then we need to check, is the dog conscious? Yeah. So is the dog aware of its surroundings? It's going to be less likely to be life-threatening if the dog is conscious. Yeah. If it's unconscious, then time is precious. Yeah.
The moment I brought it inside, it was breathing quite all right, but then in about 5 minutes time it passed away.
Yeah,
I
so it's
couldn't
probably
really make out anything.
yeah, internal bleed probably. So trauma, it's probably ruptured a vessel inside. Yeah, internal bleeding. Yeah, was it very white?
No.
No.
It all happened in 5 minutes.
Yeah. So it's probably an internal bleed. Yeah, just with the impact. Yeah. So yeah, and we all know this because we're working in shelter, but always remember a dog in pain might be aggressive, yeah, so careful handling. I don't do lots of diagrams and things for handling on this course because I think when you're in the moment you just use your best ability in that moment, but it is handy to have a blanket or something like that that maybe you can put over the whole of the dog to pick it up so you're reducing the risk of being bitten, and emergency muzzling as well. Yeah, so you're probably used to tying the dog's mouth up. And so any blood loss can result in a serious outcome and should be treated as an emergency. First aid methods to stop bleeding include, what's the first type of pressure we can use on a dog? Direct pressure. Yeah, direct pressure, so you're putting your hand on it. Yeah, all right. So pressure is applied directly to the bleeding site to aid the clotting process. This can be done with clean fingers and that's known as direct digital pressure. And then you put a bandage on or use a bandage. If you put a bandage on and you see bleeding seeping through, always place another layer over the top. Never take the original bandage off and start again. There's one main reason why you would not take the original bandage off. Yeah, you're removing the clot. Yeah, good, yeah. So you're removing the clot. And actually the first clot is the strongest clot. Yeah, the first clotting process is going to be the strongest one, so you need to try and keep it in place. So if you see blood seeping through, just put another layer of bandage over, yeah. Okay, so next type of pressure. So we've got direct pressure, and then we've got, what's the next type of pressure? No, before the tourniquet stage. What's it called when we would need a tourniquet?
Indirect.
Indirect pressure, yeah, indirect. 3 main arteries generally used or injured in the dog and demonstrated are, first one lies, it splits in the chest and lies in the front legs, so it feeds the front legs, yeah. So which is the artery that feeds the front legs? Brachial. So all of these are usually road traffic accidents, yeah, so they can rupture the brachial artery. If it gets ruptured in the armpit, you can't tourniquet it because it's deep in the armpit. What you need to do is put an object in there, like a rolled up piece of material, or in the UK I usually say put a tennis ball in there or something. So it's a perfect shape for a large dog. Press it really hard into the dog's armpit. It might just stop the bleeding enough for you to get to the hospital. Next one, common one, found on the inside of the back legs. So which artery feeds the back legs? Femoral, yeah, femoral. They can get the femoral artery on the inside of the back legs, yeah, all right, and they can bleed heavily out of that. You need to put pressure on that or a tourniquet. And the last one is the tail. Does anyone know what the artery in the tail is called? It's got 2 names. Coccygeal, and the other name is caudal, C-A-U-D-A-L. So they're both correct, all right? And usually this is where dogs' tails have been trapped, car boot lids, things like that, but here will be road traffic accidents, yeah. So these are going to bleed really heavily, so you can actually put a tourniquet on them, unless it's the brachial artery where it's deep in the armpit, yeah. So tourniquets, you can use a strip of material and tie it above the wound and gradually tighten it until the bleeding slows down. They should only be used for a short period of time as they stop the circulation to the tissues below. Should not be left on for any more than 15 minutes, and once removed should not be replaced for at least a minute, allowing the blood flow to recirculate, because you need to keep that limb oxygenated. If it's lacking oxygen for any length of time, then the capillaries die, causes gangrene, yeah, and then usually the limb has to be amputated. It happens the same with bandages that are put on too tight and left on. You get gangrene, yeah, all right, so it acts as a tourniquet. So never cover a tourniquet as well, because you might forget about it. Yeah, so if you're covering the dog in a blanket, leave the leg with a tourniquet on exposed so nobody forgets about it. So if we've got some bleeding, it means we've got some wounds. So we're just going to look at the very basic wound categories really. So the most basic of wounds can be divided into 2 groups. So what's the most basic of groups? Open and closed, yeah, open and closed. So an open wound is one where the skin surface is broken, yeah, broken, yeah. So we've got 4 common types of wounds here, all right. So first one, anything made by a sharp object. So if it's got clean edges, it's known as a incision, yeah, incision. Anything irregular, so it's got irregular edges, laceration, yeah, laceration. Small size but can travel under the tissue, punctures, yeah. A painful graze usually caused by road traffic accidents. Abrasion, yeah, abrasion. So again, difficult to tell with black and white pictures here, but this is a cat with a shoulder injury, so I'll give you a clue. It's easy to see when it's in colour. It's got really clean edges. So what type of wound is that one, the first one? Incision, yeah. So the first one is an open incised wound. And the second picture, yeah, puncture, yeah. So you see the black hole in the middle, that's a puncture wound, all right? And you can see all the bacteria coming out. You'll know because you'll deal with bite wounds all the time. If they're not treated, very nasty, because the dog's skin is not attached to the muscle layer, like ours is attached. But with the dog, they've got a gap in between. So when you get bacteria in there, and then the hole heals up, it traps all the bacteria, and then it breaks the hole down and all the bacteria comes out, yeah. And then you have to clean it all out and put drains in and things like that, yeah. Okay, so treatment, first stop the bleeding and apply a bandage if appropriate. So then we've got closed wounds. So that means that there's no break in the skin, but the underlying tissues are damaged. So the most common closed wound, yeah, hematoma. So basically the ear flap is a sealed unit. So when you get a burst blood vessel and the ear flap, the blood can't go anywhere, so it fills up like a big balloon. Yeah, you'll have seen it. Yeah. And the next one, medical term for a bruise? Yeah. Yeah, contusion. Yeah. Okie doke. Okay, shock. So shock can be a killer, it can be immediate shock or delayed shock. So shock is when the supply of oxygen, yeah. Oxygen and nutrients to tissues is affected and can be life-threatening and has to be treated immediately. So the most commonest one you're going to see is hypovolemic shock. So if you break that word down, any word with the word hypo in it means low, yeah. So it kind of gives you the answer. Vol is volume, emic is anything to do with blood and blood supply. So the most common type of shock is the reduction. Reduction in circulating blood volume. Next one, vasculogenic shock. So this is where the blood vessels dilate, blood pools and blood pressure drops, yeah. So it's the body's natural response to an event is directing all the oxygenated blood to the vital organs, yeah, to aid survival. And the last one, not that common in dogs unless they have an underlying heart condition. So it develops if heart function is impaired so that cardiac output is reduced. As I say, not that common. But in the UK, we have certain breeds that are in the veterinary practice all the time for heart failures. So I don't know whether you know which of the breeds in the UK that die young of heart failures. First one is the Cavalier King Charles Spaniel. And the next one, and you have one of him here actually, boxer in the UK again, really high with heart conditions, yeah. There would be what capillary refill time if the dog's in shock? Slow, yeah, slow capillary refill time. So we know that the capillary refill time is 1 to 2 seconds, so anything longer than that, the dog could have a circulatory issue or be in shock, yeah. Shallow respiration. Then if they keep going into shock or keep losing blood, taking them into hypovolemic shock, they will lose consciousness. Yeah, then they will convulse and then die. So that's why in any emergency, the first thing you've got to address is bleeding. Because if they're losing blood, they're losing oxygen. So you've got to get the bleeding stopped. So a hemorrhage can be classified according to the type of blood vessel damaged. So the first one, beginning with A, is the most serious form of hemorrhage and the blood is bright red. It spurts forcibly, it spurts with the heartbeat and has a definite bleeding point. Arterial bleeding, yeah. So that's where you would be using tourniquets and direct pressure, indirect pressure, yeah. The next one, a slightly less serious, and it is dark red blood. It's a steady stream but may pulsate slightly and has a definite bleeding point.
Venous.
Venous, yeah. And the last one, beginning with C, occurs in all wounds, bright red, steady ooze, little or no force and no definite bleeding point.
Capillary?
Yeah, capillary, yeah. How old the injury is as well. So if you get primary hemorrhage, it usually happens in the first 24 hours. So you get immediate damage to a blood vessel wall, blood pressure drops, blood clots and hemorrhage arrests. Then we get reactionary hemorrhage, so that happens 24 to 48 hours. So blood pressure rises, the primary clot is displaced and hemorrhage begins again. All right, so that would be a reactionary hemorrhage. Then we get a secondary hemorrhage, so this is 3 to 10 days. Primary blood clot or area is destroyed by infection and then starts to hemorrhage. Yeah. So then we've got to look at where the blood escaped to. Was it external body surface or an internal tissue or body cavity? So external will be open wounds, nose, ears, mouth, stomach lining, urinary tract. And internal, these can be difficult to detect, which is probably what happened with your car accident, will show signs of shock, clotting deficiency or internal organ damage. The natural arrest of hemorrhage, so this is what the body does when it gets injured or cut. The retraction of the cut ends, it recoils, the elastic tissue contracts, decreasing blood flow and then clotting happens. There's a drop in blood pressure, so less blood reaches the affected vessel, less pressure to force the blood out of the cut end. And back pressure is where the internal hemorrhage fills a cavity and no more blood can escape. So back pressure is like your hematomas, yeah. So that'd be a good example of back pressure. And blood clotting, platelets adhere to the vessel wall, fibrin adhere to the platelets and the blood clot is formed. Yeah, so that's the start of the healing process, yeah. So common injuries sustained in road traffic accident could be what? So I'm just going to give you a few minutes to think about the fractures of which bones are the most common. Dislocation of which joints is the most common? Think of ophthalmic injuries. So ophthalmic means anything to do with the eyes, and soft tissue injuries. Yeah. So I'm just going to give you a few minutes, and you can discuss amongst yourselves. Yeah. You need to give me some examples, and then we'll just shout them out. Yeah. Yeah, so vertebra, spinal fracture, yeah. Femur, yeah, yeah. Then we can get dislocations of which joints in road traffic accidents. This usually happens, yeah, shoulder joint, yeah. Knee joint, stifle, yeah, yeah. So yeah, the hock, stifle, hip, elbow, shoulder, they can all be dislocated. Ophthalmic injuries, yeah, yeah, so head injury, what would happen to the eye? There's two things that could happen to the eye. Yeah, so yeah, punctured eye or prolapsed eye. So that's where the eye comes out, but it's not.
Oh, I didn't know you could say that for eyes.
Yeah, prolapsed. Yeah, prolapsed eye, yeah. And soft tissue injuries.
Hernia.
Yeah, hernia. Okay, so fractures are going to be the most commonest thing, aren't they? So fracture should be treated after a full body evaluation has been made. Several general points have to be considered when dealing with fractures. So you need to prevent and reduce hemorrhage. So if there's an open fracture, cover the wound to prevent further risk of contamination and prevent any licking of the area. So you don't want any more contamination if it's an open fracture, so there's a bone sticking out. Yeah. Okay, so just an X-ray test here. So the first three pictures, can you name those bones? Yeah. Tibia and fibula. Third one is the humerus. Second one, femur. The fifth picture, dislocation of the elbow. And the last picture is a ruptured, yeah, which ligaments are in the stifle. It's a common injury with dogs where they rupture cruciate. So we've got cruciate ligaments in our knees and we can rupture them, so dogs, it's really common. Okay, another exercise for you, so I'm just going to give you a few minutes. You've witnessed a road traffic accident involving a dog. What are the common situations where dog can be involved in an RTA? And this is across the world, you know, the reasons why dogs get into road traffic accidents, yeah. So the reason for the dog, why is it in the road, yeah. The next part is you rush to the dog in the road, what are your first actions? So if you just read through those, yeah, a few minutes, fill those in, we'll just hear your ideas, yeah. Yeah. You want to shout one of your ideas?
Idea. Firstly, crossing of the road. Situation is crossing of the road for food.
Food, yeah, yeah.
Sudden sound of crackers, maybe.
Yeah, yeah, yeah.
Rash driving.
Hmm?
Rash driving.
Yes, so driving, yeah, yeah. In the way of cars. Hmm? Frightening, yeah, so the dog's in fear, so it's running away from something. Remember, when a dog's in panic, it'll not, yeah, it doesn't know what's going on around it, yeah, yeah. So, yeah, you've come across a dog that's just been hit by a car. You rush to the dog in the road. What are your first actions?
First put him on the side.
Yeah, get him to safety, yeah. You've got to make sure that you're safe as well, yeah, so you've got to you know, take into account your safety as well as the dog's safety, yeah. Check its breathing and then look for bleeding and stop the bleeding, yeah. That's probably the only thing you could do, yeah. Okay, so list the potential injuries found and how you would give first aid treatment. So somebody pick an injury and then we can discuss. So bleeding, yeah. So got a bleeding dog, so a bleeding what?
Give you direct pressure first.
Yeah, so they've got a bleeding leg, direct pressure, yeah, so that's an example. So you can put that one as the first one. What would your action be with a fractured leg? Yeah, yeah. So I wouldn't splint it, I would just gently put a towel around it. So you're just restricting it, stopping it from displacing any further. Yeah, all right. So fractured spine, the dog will demonstrate straight away it's got a fractured spine, it won't be able to walk. Yeah, so then you would just stretch her. Pardon?
How will it react?
Yeah, it's probably trying to bite you, but it can't run away, so it's laid flat on the floor. So you put it on a stretcher or a blanket and carry it, yeah. You may need to muzzle it, yeah. Seen skull fractures? Anybody seen a skull fracture? Yeah, yeah. Because what happens, isn't it, the head moves like that, yeah. So if a dog's got a skull fracture, when it's breathing, the head kind of moves like that, it kind of like bubbles. So if you see a dog's head moving independent like that, it's probably got a skull fracture. So I wouldn't do anything, I wouldn't touch it till you get to the vet. Yeah. So at this point we need to determine whether the dog is dead or not and looking for the following. So we're looking for heartbeat, breathing, etc. So if we do find a heartbeat on an unconscious dog, the heartbeat may be kind of slow and weak. Slow and weak would be good. Yeah, slow and weak. Yeah. Body temperature remains stable, so you know at this point it might be a good idea to take the temperature just to see what the rectal temperature is. Yeah. The cornea, which is the shiny surface of the eyes look alive if the dog is alive. The eyes are still moisturised. Yeah. When a dog is deceased, usually within 10 minutes the eyes look very opaque and blue looking and dry. Yeah. All right. The pupil will still react to light. So if the dog is unconscious but the brain is still alive, messages are sent from the brain through the optic nerve and still saying we need more light, less light. Yeah. So if the dog is brain dead, then that stops, and then the pupil is described as fixed and dilated. Yeah, fixed and dilated. Yeah. So it goes like a big black hole and stays there. Okay, so treatment: check that the airway is open, loosen the collar, pull the tongue forward, extend the neck, feel for chest movements and a heartbeat, and keep the dog warm. All right. So what we're doing now, we're kind of drifting into CPR, so cardiopulmonary resuscitation. So if we don't find any vital signs and it's an immediate event, we can think about doing CPR. All right. So CPR has got two parts to it. So the first part is if you cannot feel a heartbeat, you'll have to perform what? Which part of CPR will you have to perform?
Heart massage.
Yeah, heart massage or cardiac massage. I'm going to show you, and you're going to have a go. All right. Then if there's no chest movements, you'll have to perform what? So if the dog's not breathing, artificial respiration. Yeah. Recognition of an impending or actual cardiopulmonary resuscitation is essential. So you're looking for gasping or laboured breathing, weak or rapid pulse, loss of consciousness, fixed or dilated pupils, and mucous membrane colour. All right. So cardiorespiratory arrest results when oxygen. Yeah, oxygen to the heart and brain is disrupted. So you must do it immediately. You can't do it after 10 minutes if the dog's been deceased because the brain is lacking oxygen. Even if you did get the dog going in that situation, it will be left with brain damage. Yeah, all right. So definitions: respiratory arrest just means stop breathing. Yeah, so respiratory arrest, stop breathing. And basic life support is your CPR. Yeah, CPR. So an unconscious dog should be placed in lateral recumbency with the head tilted upwards and the tongue gently pulled out, so the airway should be clear. So you check for vital signs, so you're looking at the breathing, heartbeat, pulse. If there's no heartbeat, no pulse, no breathing, then CPR can start. You cannot do CPR if you've got any type of vital signs. Yeah, all right. So rescue breaths first. Now this is something you've got to consider in this country because of zoonotic diseases. All right. So in the UK we don't have a problem with anything like that. So in this country you've got to think seriously whether you would want to do artificial respiration. It would be your choice whether you did that or not. So what I'm going to do, I'm going to do the CPR with the cardiorespiratory as well. But then if you're in that situation, you can choose whether you want to do it or just concentrate on the cardiac massage. Yeah, all right. So the dog's mouth should be firmly closed by wrapping in one hand around it. If it's a bigger dog, you can use two hands. All right. The neck should be extended so the muzzle follows the same line as the spine. This ensures maximal opening of the airways. Place your mouth firmly over both nostrils, creating a seal, and blow hard so the chest is inflated. Look at the chest as you blow. Keep it going until you see it rise as it inflates. You should aim to keep the chest inflated for around 1 second. Okay. So the chest compressions, larger dogs benefit from compressions over the widest portion of the thorax using the thoracic pump theory. And that's because the rib cage is big, so the heart is further away from the rib cage. So you have to do it bang smack in the middle of the rib cage. We're utilising the vacuum that's in the chest to press the organs, to press the heart, to pump the blood round. Yeah. With little dogs, you can do it over the heart itself because the rib cage is smaller, so the heart's very close to the rib cage, so you can actually press the heart itself. Yeah, all right. Barrel-chested breeds such as bulldogs, I mean you probably won't get that many over here, they may benefit from sternal chest compressions, so that means you put the dog on its back. So you might get, in the UK we have big sort of French Mastiffs and things like that where the chest is very wide, so you put them on the back and do them like a person. Yeah, all right. And little dogs you can do 2 fingers and a thumb, yeah, like that, or like that, over the heart itself, yeah, all right. Smaller keel-chested dogs and cats may benefit from compressions directly over the heart, employing the cardiac pump theory. So either just the heels of your hands or 2 fingers and a thumb. All right. Okay, what I'm going to do now then, I'm going to get the, I've just got a little dog here. I usually have a big, proper resuscitation dog, but it's just too big to bring over. All right. It just fill the whole of the suitcase and no room for clothes. So this is my little travel one, all right, so, all right. Heartbeat, circulation. So you're looking at the nose first. Is there any twitching of the nose? Yeah. Put the hand on the dog's chest, see if there's any breathing. Yeah. Then feel for the heart, which is just behind the elbow. Yeah. And if you've watched dogs flat out fast asleep, you can see the heart beating just behind the elbow. So that's exactly where you need to feel with a couple of fingers for the heartbeat. So no heartbeat. Then just double check for your circulation with the femoral artery, which is on the inside of either back leg. Yeah, the pulse, yeah. So no vital signs. The accident's just happened, so it's just been hit by a car. So it's a candidate for CPR, yeah. So I'll do it with the respirations, and then what you need to do if you're in that situation, you need to decide whether you risk doing the respirations, yeah, all right. Just because of the zoonotic, yeah. Okay, so what you have to do is completely close the mouth. If it's a bigger dog, you can use 2 hands, all right? In a real situation, you'd be putting your mouth round both nostrils or the whole of the dog's nose and inflating the lungs, all right? But what we're going to do today, just because of hygiene, if we stop about there and go through the motion of breathing. Now you need to do a few rescue breaths, so the best amount is 3. Yeah, 3 rescue breaths is fine, yeah. And while you're doing it, you need to watch the chest rise. Then give it a chance to deflate before you do number 2 and number 3. Yeah, all right. So, 1, 2, 3. Then you can do your chest compressions. Now it's 30 chest compressions. It's the same as people. If you ever do a human first aid, it's 30 chest compressions, yeah. So if I do a little dog first, you need to be just behind the elbow. Yeah, just behind the elbow, because you're going to be doing the compressions over the heart itself, yeah. And you need the heel of your hand, the second heel of your hand, and use your weight, all right? And you do 30 of those, and it's 2 per second, yeah? So it's fairly quick, yeah? So 1, 2, 30. Once you've done your 30 chest compressions, then 2 breaths in between, yeah? So 1, 2. And I would say after, in between each round, just have a quick check for any vital signs. So any heartbeat, pulse, any breathing, yeah, nothing. If there's still nothing, then you would continue, yeah? But if any of the vital signs come back, you need to stop. Okay, the big dog, if you can imagine this is a bigger dog, you need to go bang smack in the middle of the rib cage, the highest part of the rib cage. And you need to be a bit harder here. You need to do them really quite vigorously. And again, the weight through the heels of your hand. So it's 30 compressions the same, but in between each compression, just lift off marginally, because you want the dog's chest to go back to its full capacity so the heart can go back to its normal shape and draw blood into it, ready for the next compression. So it's 30 of those, all right? So again, just using your weight. So then 2 breaths in between, the same. 1, 2. All right, and then a check, exactly the same. All right, and you just continue until you decided that enough was enough, or the vet decided that, yeah, there's no future. Yeah, all right. Okay, so who wants to go first? Yeah. Probably 20 minutes is probably, yeah, do you think after 20 minutes there's no response then? Yeah, all right. Okay, I'll choose. So it's best to start at one end, otherwise people step back and people don't get a go. So we'll start. Minnie, yeah. So when the outside air temperature is equal to or higher than the body temperature, heat stroke can occur, because dogs can't lose heat through sweating. They sweat a little bit through the feet, but that's usually when it's stress related, not usually when it's heat related. Yeah. So they can only really lose heat through panting, because when they're panting, two things happen. The tongue comes out, and the large surface area, they dissipate heat through the tongue. And the other one is when they're breathing in, the air goes over the turbinates in the nasal passages, which helps cool air. So that's why we have problems with dogs with flat faces, such as your pugs and your French bulldogs and things like that, because these turbinates in the nasal passages are not there because we've squashed the face, so they overheat quicker. Yeah. All right. So it's basic biology and physics really. If you've got an overweight dog especially, it's got a large surface area that it cannot lose heat from, can't sweat from. It's only got 4 little feet that size that it can't sweat properly from, and it can't pant properly. Yeah. So the internal heat goes up. The problem with heat stroke is that it's usually progressive. So even though you address the heat stroke with cool water and things like that, the temperature, internal temperature will still keep going up. Then what happens, the brain gets confused, and then they just go even higher temperature, and then they usually convulse and then die. All right. All the body cells denature and they can't carry oxygen properly, and the dog will die. Yeah, so you've got to be really careful with dogs overheating. If you've got a dog in heat stroke, you have to bring the temperature down gradually. So don't cold plunge the dog, just put it light on a wet towel or just in water with a couple of inches, and then just put water on it with a wet towel on it. Yeah, on and off. Takes about an hour and a half to get back down to normal temperature. And if it's a really bad heat stroke, then what can happen? You can get kidney failure as well, yeah, because damage to the kidneys, yeah. All right, okay. So any questions on first aid? Is everybody okay with that? I think the CPR is probably the most important one.
So have
yeah.
you had success with CPR?
We do in practice, yeah, yeah. Oh yeah. Usually it's where anaesthesia's being compromised, yeah. Usually with sudden situations like road traffic accidents, it's difficult, yeah. Bandage is really for emergencies, so it's not a bandage that's going to be left on for a few days. If you're leaving bandages on for a few days, you have to pad in between the toes and everything, yeah. So this is just a foot or a cut foot that's bleeding lots. You need to get a quick emergency bandage on it. So your conforming layer, which is any stretchy white bandage, is fine, yeah, all right. Always start above the joint, because the joint will act as an anchor to keep the bandage on. If you start it here, it'll just slide off. So just start it well above the joint, all right. So top to bottom, over the end, and you can put a little bit of stretch on it, because remember it's bleeding, so you need to get some compression. Back to the top and then wind down, all right. When you're coming down, come at an angle, because then you can get some really good figure of eights over the end. Then you do exactly with the outer layer, which is your vet wrap, or it's got, yeah, vet wrap, yeah, it's got different, a little bit, all right. Top to bottom. And again, come down at an angle, so you can do figure of eights over the end. And remember, if you see blood seeping through, just put another layer on, yeah. And it's usually sticky enough, new ones, yeah. So each toe, each joint, because it's all connected, yeah. And the hip joint, so you're just doing gentle range, it's called ROM, so range of movement. So you're not forcing it, you're just rotating it in the joint. It'll just be a few minutes. Then you need to do the muscles. Yeah, so we can do each muscle individually. So it's just gentle, especially with these puppies. So just gentle massage. Just keeping the blood supply going. And just massaging round the hip joint. And actually feel how much muscle wastage has happened already. Then you can take the tail and massage the base of the tail. So you just get the tail and just do gentle rotations. It's just either side of the spine, vertebrae, just little massage. And the other method, has anybody heard of Tellington touch? But we shorten it to T-touch. So if you ever hear T-touch, basically what T-touch is it was developed by an American lady called Linda Tellington Jones in America about 30 years ago, and it's really taken off as a kind of massage. So what you do, you just get your fingers like that, and you do 1 1/4 circles massage. Yeah, it should take 2 seconds to do 1 1/4 circles, and it's all over the dog's body. What that does, it helps the cells communicate with each other, you know, loosening the skin layer, all right. It helps with the immune system, helps relaxation, circulation, everything. And what you do is you basically put your fingers on and you do, it's a clockwise full turn 1/4. You're not sliding over the fur, you're keeping your fingers on and then slide to the next area, slide, yeah. And the places to work on are around the mouth, because dogs hold a lot of tension in the mouth, yeah, like that. So we do little massages. And then around the ears. There's lots of feeling and nerves and everything in the ears, so you can do around the ears. And then you do ear slides, which is just like that. Another really important area is in the hindquarters. Dogs hold a lot of tension in the hindquarters, so you do the Tellington touch there as well. Helps relaxation. So it's really basic, but that's what I would do just a couple of times a day, just to keep that range of motion going, keeping the muscles communicating, the nervous system communicating with the brain, yeah. And the other things you can do is the hydrotherapy and that kind of thing. Has she been in the water yet? Yeah. All right. Yeah. Is she kicking? The front legs. Yeah. All right. What you can do is get somebody to hold her front and somebody to do that with the back legs in the water. Yeah. So try and encourage her to push off. Yeah. So it sounds what you're doing is perfect. Yeah. Because you don't want to do too much and rush it. Nerves, yeah, we know that they can take forever to heal, or not at all. Yeah. But the fact she's got deep pain sensations is a good sign. Yeah. Just not like the black puppy. It's nothing. Yeah. And you can, I think I can feel a fracture of the spine. Yeah. Is everybody happy with that? It's real simple techniques just to keep the dog moving. Good.
Anything else? Anything else you would want her to explain? Practical. I mean, some commonly.
Pardon?
To initially give the first aid, we need the medicines and the kit.
Yeah.
Kind of a kit. What are these items that we need to carry every time?
Okay. Yeah. What I can do, I can send you a first aid kit list. Yeah. Bee stings, insect stings. If it was a bee, then what you need to do is put something alkaline on. So bicarbonate of soda or milk is good. And bees always leave the stinger. So you need to pull the sting out, but you need to take it out sideways. Scrape it out sideways, because the stinger's got a barb on it. So if you pull it and you trigger the barb, it'll put more venom in. Yeah. If it's wasps, then you need to put vinegar on it. Yeah. Snakes, yeah, I mean, yeah, it depends what snake it is. And you guys have got more experience with snakes than I have, so, yeah. I mean, how many snake bites dogs are killed by snakes? Yeah, 50 cases, yeah. A year? Yeah. And do the dogs die? No. Okay.